Hello and welcome back. This is going to be our last unit on the nervous system. And this little section we're going to talk about spinal nerves. So we did cranial nerves last time. We're going to finish up with spinal nerves, which are a little bit different. And so you had 12 cranial nerves, and you also have 13 spinal nerves, or nerves that come from the spinal cord. So your 13 spinal nerves, you have cervical, thoracic, lumbar, sacral, and coccygeal. And you should recognize these terms. These are the same terms that we use to name bones. So you have cervical vertebrae, thoracic vertebrae, lumbar vertebrae. You have your sacrum, which is a bunch of fused vertebrae, and then you have your coccyx. With cervical nerves, you have 8 cervical nerves, C1 through C8. And so if you remember back, there are 7 cervical vertebrae. So there's one between the skull and C1, C1, C2, C2, C3, C3, C4, 5, 6, 7, 8, or 5, 6, 7, so on. You have thoracic nerves, T1 through T12. And remember, there are 12 thoracic vertebrae. So these go accordingly. You have 5 lumbar nerves. To correspond to the 5 lumbar vertebrae, you have 5 sacral nerves. There are 5 fused vertebrae that form up your sacrum. And so those 5 segments correspond to these 5 nerves. And then your coccygeal, you have one coccyx, which is comprised of 4 segments. Because that is essentially your tailbone, there's only one nerve coming off of it. So there's 4 segments fused into one, so there's one nerve coming off of that. Here's a look at your your spinal nerves. You see your 8 cervical vertebrae here, followed by your thoracic, then down into your lumbar. Your sacral nerves all come out and go through these sacral foramina, which we looked at, and then you have your coccyx down the end that's got one coming off of that. But that's a look at where your nerves come from and how they kind of fit in. You'll see this region here where it starts to taper off. This is that region known as the cauda equina, which looks like a horse's tail. So cauda refers to tail, equine refers to a horse. So that's your cauda equina. Spinal nerves they meet. What they do is they meet and leave at the spinal cord. And so there are nerve attachment sites in one of 2 locations. There is both a dorsal root and a ventral root, which basically means it comes out the front or comes out the back. And so the way this works is anything that comes out the ventral side, out the front, is a motor root, meaning it's a signal that came from the brain, is leaving to go to your body and to cause the effector to move, whether it's a muscle, whether it's a gland, causing something to happen. Your dorsal root, that was the ventral side. Your dorsal root, so down the back of your body, is all of your sensory attachments, sensory locations. So your sensors, your feelings that come into your spinal cord and have to go to the brain, all come in from the back. They come in this dorsal root here. So you have a ventral root in the front and a dorsal root in the back. You'll notice there's a little term here called the dorsal root ganglion. Ganglion just means a large conglomerate of nerves. So a bunch of nerves can come together here, and then they all go to the spinal cord. You'll see as well we have some different terms we're going to talk about. We have a posterior horn, we have a lateral horn, anterior horn. These are all just shapes. And you will notice there's 2 different colors to your spinal cord. Out here is a whiter region, and in here is a darker region, a gray region. So we call it white matter. It's called white matter and gray matter. The white matter is matter surrounded by either meninges or myelin. More commonly, it's myelin. But the idea is this is the protective covering. So in your spinal cord, it'll actually be meninges covering it, but it's the myelin out here that's going to cover it, and that's your white matter. So the white is the myelin or the meninge covered stuff. Gray matter doesn't have that covering. This is an exposed root, or exposed nerve that has to deal with interference and all of that. These nerves, spinal nerves that are in your body, innervate your muscles that allow you to move and allow you to function. So your arms are controlled by your lower cervical and upper thoracic nerves. So C5 through T1 control your arms. These nerves form what's called the brachial plexus, which is again just a big conglomerate of nerves, a large region where things come and go. These all control your arms. Your hips and upper legs. So hips and upper legs are innervated or controlled by your lumbar plexus, which is made up of the nerves L1 through L4. Your legs, lower legs in this case, are innervated and controlled by your lumbosacral plexus. These are the nerves L4 through S3, so your fourth lumbar nerve through your third sacral nerve. Your genital region is controlled by your sacral plexus, which is your going from that third sacral nerve down to your coccyx, your coccygeal nerve. And then your trunk, your core, is innervated by intercostals. So your T1 through T12, all of your thoracic nerves innervate your core. So all of your gut organs, everything that happens there, are innervated by these nerves, T1 through T12. You'll notice in most cases, the structure being controlled, so for example the arms, is controlled by nerves that are leaving your spinal cord at a point that is superior to this one. So my arms form at the shoulder, which is right about the site of T1. But it's controlled by nerves that are up higher than that, being C5 through T1. Your hips and upper legs. So we're going to clear up into your lumbar vertebrae, your lumbar nerves, L1 through L4 to control your hips. So that's why when you have spinal damage, typically what's concerning is that you're going to damage the appendages in your body parts that are lower down, that are inferior to that injury point. Along with where they leave the body, your spinal nerves form what we call dermatomes. And these are essentially skin sensors on the skin, or sensors that connect to the skin. And this is where spinal nerves are kind of interesting, kind of funny. But we have this phenomenon called referred pain, or this occurrence called referred pain. And this is where you feel pain in an area that's different than where the problem actually occurs. We're going to look at some examples of this. But you have pain somewhere that's not actually hurt, but the pain is indicating that, hey, there's something going on at this other location. So you feel pain in a different area because the sensation you feel from internal organs is confusing to the brain. And so you feel the pain as an external pain at the same dermatome, the same location. Dermatome is a location as the nerve that innervates the organ. So for example, if you have gallbladder pain, there's a place to look for whether or not you have pain there to see if you have gallbladder issues. Same with heartburn, same with the heart, and we'll look at some of these right here. Okay, so these are your vertebrae leaving the spine. And then here are just some different regions and things that can cause pain here. And so that just gives you an idea of where these nerves are leaving at. And then this will tell you, here's a referred pain chart, which is really interesting in most cases. For example, if you have liver issues, if your liver is struggling or your gallbladder is failing, you're going to have pain in your right shoulder. The right side of your neck and your right shoulder is going to become very painful, or you'll notice it there. If you have one of the leading diagnostics for a heart attack, and one of the ways that people can tell they're having a heart attack, is their left arm goes numb. You get tingling here, and your left arm goes numb. If you have tingling in your left arm, and you lose feeling in your left arm, that's an indicator of a heart attack. And that's that's what doctors and medical personnel are trained to look for. Other things, you have your gallbladder is located up in here, and you have pain down below. Your appendix, so you have a ruptured appendix. Appendix is there. Your appendix is pretty close to that location. Same with your ovaries are pretty close to those locations. Your urinary bladder hurts in the back, or it hurts down on your legs, on the inside of your legs, which is just a little bit different. Your lungs and diaphragm, same thing, the orange one. Probably going to be pain in your neck. It's not going to hurt in your chest where you would expect it. For your diaphragm and your lungs, it's going to hurt up here. So all of these are referred pain scenarios where you're having pain other than where it hurts. So these are your dermatomes, your sensory to the skin. This is where we feel it on the skin. So landmarks, your head is the C2 nerve. Your traps are the C4 nerve. Your shoulders go to C5. Your upper pectoral muscles are innervated by the first thoracic nerve. Your nipple line is controlled by the fourth thoracic nerve. Your belly button is the ninth. Your iliac crest to your groin is the first thoracic. All of these are sites that you will feel pain if that nerve is damaged, but it doesn't make a lot of sense because that's not where the damage is actually taking place. The bottom of your foot and the back of your leg is coming from your first sacral nerve, which are not even close. Okay, so these are dermatomes. So these are the landmarks. These are the spots on your skin that you feel pain, that you can feel pain to the touch, but it's not that point that actually hurts. So that's what those are. All right, and that wraps up this unit. That wraps up our nervous system. So we've answered questions 1 through 5 regarding cranial nerves. Now you can answer questions 6 through 11, talking about spinal nerves. So work through those. Let me know if you have questions, and I look forward to seeing you again and reviewing the information with you.